At this hour, Maryland has at least 85 cases of COVID-19. Most are in Montgomery County, followed by Prince George's County. Maryland Governor Larry Hogan has shut down schools for weeks and made several major changes to combat the coronavirus. Governor Hogan joins ABC7 Live right now from the Maryland Governor's office in D.C. Governor, thank you for spending some time with us. First, do you have any updates on confirmed cases in the state?
So we're getting numbers, almost constantly, but I'm really not ready to update any numbers. We do that we have a team meeting once at the end of the day and once in the morning, but it's just suffice it to say that the numbers are escalating dramatically and rapidly on a daily basis and increasing every day. But 78% of all of our cases are in the Washington area in either Prince George's or Montgomery County, as you mentioned, which is sort of staggering.
And folks have been asking a lot of questions about the availability of these tests, COVID-19 testing. Is there an update on the status of those tests in Maryland?
So I'm the chairman of the National Governors Association. I convened a meeting, a conference call of all the nation's governors earlier today, and I just hung up the phone from the White House right before talking with you. This is still a major concern that we're all trying to address. All the states are trying to ramp up. The federal government is trying to address this issue of testing, and private sector labs are trying to ramp up. But it's still an issue that's being addressed, and the simple answer is at this point we don't have enough tests, and everybody's working hard to try to fix that problem.
What about disaster assistance loans? A lot of small businesses really feeling the impact of this pandemic, and it's only been a matter of a few days right now that they've been closed. What is being considered in terms of possibly tapping into rainy day funds? Is that something on the table?
Yeah, so our first order of business is to try to save in our state thousands of lives of Marylanders, and people are fighting to try to save hundreds of thousands of lives across the nation. And so we're trying to work on the health and safety front, but we're also looking at the economic front because so many people are going to be hurt by this. So many people are going to lose their jobs, small businesses, unemployment. This is something that everybody's trying to address. So we passed today emergency legislation in our state legislature to try to address some of these issues. Under the state of emergency, have taken some direct actions with our Department of Labor, our Department of Commerce. We're tapping our rainy day fund, and the federal government. I think the Senate just a few moments ago just passed a big emergency stimulus package here in Washington, and so everybody's trying to address this issue. But there's no question it's the worst public health worldwide pandemic that we've ever faced in our lifetime, and it's also going to be one of the biggest economic crises we've ever faced. It's something that everybody is dealing with and working around the clock at the federal, state, and local level.
Certainly, yes. All resources are being thrown at this. We know that saving lives is the priority. And speaking of that, how many ventilators and ICU hospital beds does Maryland have?
So it's a big issue that we're trying to address. It's one of the things nobody ever anticipated, the kind of surge capability, the surge possibilities, the numbers that everybody's working on. The reason we're doing this social distancing, closing schools, shutting down bars and restaurants, kind of an unprecedented step that nobody ever could have possibly imagined. But it's about stopping that surge in the hospital so we don't have so many people getting sick at the exact same time, trying to suppress that because no hospital in America has enough ventilators to handle that if everybody gets sick at the same time. So it's something that all the governors in America are talking about. It's what the White House is talking about. Folks in Washington, labs are trying to increase capacity. We're doing that at the state level, but we do not have enough ventilators. We don't have enough tests, and we don't have enough PPEs, the personal protective equipment, which is things like masks and all those things. And these are all major crises that we're working on, but there's a lot of really smart people at the federal, state, and local level and in the private sector who are working around the clock to try to take care of some of these issues so that we can protect the lives of hundreds of thousands of people.
And it's certainly frustrating to hear that we don't have enough, even at this stage. Do you have a timeline for when a shipment may be arriving? When it comes to the PPE, when it comes to the tests?
Yeah, so we were the first, or one of the first states in America to receive permission from the federal government to do our own testing, and Johns Hopkins and a number of labs are stood up here in the state, so they're ramping up pretty quickly. We're ahead of most states. We did receive a shipment from the federal stockpile on some of these things that we're just talking about, but there's only so much at the federal level, and so the president just took unprecedented action to basically force corporations to start producing these things as fast as possible. It's not like we just aren't getting them. They have to actually get them produced and get them sent out to all of the states. It's something that it's going to take a heroic, almost an effort like you would under a major war effort, and that's what's going on right now.
And Governor, I know you're working hard. You were one of the first to take a bold step and shut down schools statewide. Any other considerations when it comes to statewide restrictions that you're now looking at, since you are in this waiting period where you don't have the equipment that you need to necessarily handle what could be coming down the pipeline?
So I think I was probably one of the first governors in America to declare a state of emergency probably 15, 16 days ago. Was, I think, the first one in America to shut down all of our schools statewide. And I was one of the first ones to shut down all the bars and restaurants across the state. Many states have followed those steps. I took steps to shut down and limit some of the interaction on and the trips on some of our trains and transit systems. And we made those recommendations to Metro, who followed in those directions. The District of Columbia followed us on shutting down the bars and restaurants. We're going to probably have a whole nother series of announcements tomorrow. Every single day, this thing is changing so rapidly. It's not changing on a week-to-week basis or a day-by-day basis, but really almost hourly or minute-by-minute basis.
So what might that be, a shelter in place,
decisions
like we've seen on the West Coast?
Yeah, so we're not at that point yet, but these are the kinds of things that in our governor's call that people are talking about, what the eventualities might be under the worst case scenarios. But we're going to announce some other steps in our state tomorrow, and we're going to keep taking I'm going to make every decision I possibly can and take every action I can possibly take to keep the lives of our citizens safe and to protect as many people as we can. And it's going to be, it sounds scary and may sound extreme, and it's going to really be inconvenient and disruptive to people's lives, but I can promise you that we're taking these steps out of the desire to really keep people safe and to protect as many people as we can. Absolutely.
Flatten the curve. We've heard that term many times now, and we know you're making this a huge priority. We have another question here that just, this is impacting every aspect of daily life. What is the status of providing child care for emergency personnel, including hospital workers, those who have to be, who you want to be on the front lines to address all these medical issues that are coming forward?
Yeah, so again, we're one of the only states that took positive action in that direction. We did this last Thursday. We did an executive order that's requiring and ramping up the child care for those essential workers, but we're also doing it in a way that protects those kids and keeps them safe. So we have very specific requirements about groups of no more than 10 kids and making sure we're taking proper sanitation and health concerns, a whole series of things, but you can't just shut down all of the care so that, police officers and nurses and doctors and the people on the front lines that are trying to help everyone else, can't get to work because they've got to take care of their kids. So a lot of people are going to be inconvenienced. We're not going to be able to have daycare for everybody in the state because we closed the schools. You can't have a bunch of kids congregating together because it's not safe. But we're going to take care of those essential workers so that they can get out there and do that critically life-saving work for the rest of us.
Well, Governor, we know you're working long hours. We thank you so much for spending some time with us this evening.
Thank you.
And giving us an update. Maryland Governor